Hey everybody, Dr. Pearlman, and I wanted to make a video today. It's been a little while since I've made a video like this, and really touch on something that happened last night where parents of a couple of young children who have been bringing them in to get adjusted by me, I guess, the mom is very much a fan of chiropractic, so to speak, and has been utilizing it for herself and her children for a very long time, and seems that there are, many benefits that she can attest to. And she had been bringing in the children to get adjusted to hopefully sleep better. And the the children's father, who was in the office last night, he said something to me like he didn't believe, right, that chiropractic works for children. He believes for adults, but doesn't believe for children. So it got me thinking. Obviously, at that time, if he asked what I, thought, or if I could explain, and I did. And so what I'm hoping is that people understand, if you take it back like chiropractic roots, there's something that is very beneficial from the standpoint of tonal, like understanding tone. Tone is the way that older chiropractors used to actually describe chiropractic. They described it as almost like a guitar string, set to the guitar in the tone, too tight, too loose. If you think about sympathetic nervous system, the fight or flight response, fight, flight, or freeze response, that's too tight. If you think of parasympathetic, rest or repair, you could be in there where it's, way too loose. You want to have balance. Now, that's just the autonomic nervous system, but think of it really as a stress response to something. Say that you're not sleeping well. It's typically because of anxiety. Now, what does a 5-year-old or a 2-year-old or a 1-year-old have anxiety about? Not necessarily the same things you and I have anxiety about, but it doesn't mean that their body doesn't have some reaction to their environment and or nutrition and or an injury or discomfort that they're feeling and that maybe they can't communicate as well. And if this is something that's happening and they have that tone turned up, they're not comfortable, which then results in them not sleeping their best. So how does chiropractic help a child sleep better? Well, if you deliver the proper adjustment to the proper joints at the proper time, that tension is off the nervous system, and the child can relax and hopefully sleep better, and it will be then better functioning because they are more relaxed. They'll digest better. They'll have clearer lungs. The blood vessels will open more. All these things that we know scientifically or physiologically happen because of a not so tight guitar string or not so stressed body. And that really is, in many ways, how successful chiropractic works. And when I say successful, yes, we are talking about the difference between a chiropractor pushing on the body and not making a change, sometimes called a sham adjustment in the world of research, and other times where the chiropractic makes a successful adjustment where there's tribal nucleation or cavitation, that little cracking or crunching that happens at the joint, which is a pressure gradient changing. It's not just high-pitched snapping of a ligament that should actually never happen in an adjustment. It's much more a deep thud, very subtle thud in the right direction is how you want it. And that is what will make the child usually respond very fast. And usually it's very noticeable with children right away. That's a long-winded way for me to describe how chiropractic works for children. And before I go here, just another thing that had come up was, how often should I get adjusted? I'm an adult, right? If adults are asking about that, they're really talking about pain management or overcoming some kind of, painful injury they had. And I'll be honest, everybody's different. There is no magic word. There is no magic recommendation, excuse me. I got something in the background that keeps catching my eye. When it comes to chiropractic adjustments in terms of the frequency, it's all about finding your dose response. It's all about finding how well do you respond based off of your dose of chiropractic And what are you doing in between that may signal you that you might be due for another adjustment, really what they would call it a checkup at a chiropractic office. And then making sure that the chiropractor is working in combinations and patterns of specific adjustments, let alone if there's any other modalities they need to do. You know me, I'm a big fan of shockwave therapy, and that those, could last anything from weeks to months, sometimes just days. It depends on the acute nature of an injury, the chronicity of the injury, and if it's been like a recent flare-up, or if exercises are needed to stabilize, or if more adjustments are needed to mobilize. And really, those things take nuance, and they take understanding, and they take trust, and they take a good relationship between chiropractor and patient, mechanic and Lamborghini. And those things matter so much when it comes to chiropractic care when you're talking about pain cases alone. So I hope this helps. I hope this video brought value and education to your day, to your life. And if you guys ever need anything, it's Dr. Pearlman.